This conference is supposedly to strengthen and shorten the bridges that are widely spaced between the mutual doctors that take care of conditions involved in managing people with complaints that relate to musculoskeletal disorders. Those include orthopedic doctors and general practitioners. This conference is to bring up the new updates into the field of rheumatology to be available for the doctors in the region in the field.
Great. And what are some of the topics that will be covered in the conference?
This is a very important conference that usually summarizes some of the main topics in rheumatology that will cover osteoporosis, recent advances in diagnosis and management of rheumatoid arthritis, conditions like ankylosing spondylitis, gout, also some problems with back pain and painful knees. Me personally, I'm going to talk about how to use ultrasound in the clinics to diagnose and to treat conditions like rheumatoid arthritis.
Great. And for the delegates, why should they attend this conference?
Well, it's a pristine opportunity for them because some of them might travel to Europe and North America. Basically, this conference has big names in the field that will give such meetings objectives in this conference, and the delegates will have hands-on training in some of the important workshops that are offered at this conference. It's just expanded, swollen, full of cells. If you concentrate on in here, this is the normal bone line, but here it's somebody ate into the bone. Somebody took a chunk out of the bone. This should be like this. Also here there's a normal neck-like structure here, but here all of these cells are meant to attack the cartilage and then go into the bone. This is basically like a laptop ultrasound machine that the rheumatologist can carry with him wherever he goes into different hospitals. This machine is like the machine used to diagnose conditions that affect the heart, or even look into babies in mother's wombs. This will look into the patient's joints, like this patient who's, I'm looking here at her wrist, and it will show her bones and show some of the fluid that is inside the wrist. So it is looking basically, if you see here, this is the fluid, and these are the bones which aren't that clear. There are some erosions inside this wrist. So if we look into this image, there is the skin and there are the tendons, and just looking at the cross-sectional view of the wrist with the bones here. Here, this is an active wrist, and we can convince ourselves and the patient at clinic that more aggressive treatment is needed because of the kind and nature of the disease. It is eating into the bone. Almost every joint and tendon is not spared in this image. So it gives us a better idea on what's going on inside the joint. It's like our stethoscope.